And this is Marie-Chantal, clinical audiologist and tinnitus specialist. Today I'm going to talk about health anxiety, what is it, and how it may be influencing your tinnitus or any other health condition you can apply this to. To a certain extent, milder forms of health anxiety can affect us all from time to time. It is absolutely normal to be concerned when we're waiting for test results to come back, or maybe we've had some worrying thoughts about a new lump we've noticed. But while having concerns about your health and seeking appropriate advice from health professionals is one thing, there can be too much of a good thing. So too much of that can actually be really bad for you. Health concerns can become a problem when they are excessive, out of proportion to the realistic likelihood of having such complaints or serious medical problems, are persistent despite negative testing, negative results, and reassurance from your practitioners. It may lead to unhelpful behaviours such as excessive checking, reassurance seeking from doctors, families, friends, social media groups, or perhaps you're avoiding checkups or health-related information. And it may cause you significant distress or impair your ability to go about your day-to-day life. After learning about all of those things, how do you think you are behaving? Do you think you have health anxiety? Have a look at yourself. Are these things in your life that you can release? Are these supportive behaviors that you're engaging in, or are they unsupportive behaviors? For those people who tell me, but I have real symptoms, I'm hearing tinnitus all the time, it is important to recognize that health anxiety can exist in people who are healthy and people who are not quite so healthy, in people who are actually experiencing real yet unexpected medical symptoms, and in people who have diagnosed medical conditions. So it means that health anxiety can really apply to anyone. With or without actual symptoms, it doesn't really matter. That's not the core of what health anxiety is. Health anxiety is when the main issue is anxiety about your health. The issue is not whether or not you have actual symptoms. The issue is how you are responding to and coping with your symptoms or condition. So if you respond to your health issues or symptoms with excessive or persistent worrying, checking, reassurance seeking, or avoidance, then health anxiety may still be a problem for you, or is a problem for you. In order to break the tinnitus cycle, it's actually really essential that you break the anxiety cycle. And health anxiety comes under that umbrella. So if you see yourself in that list of behaviors or symptoms of health anxiety, then I suggest that you actually take stock, perhaps look into getting some support to break out of that cycle, and also implementing new supportive behaviors for yourself. So stopping the constant checking of social media forums or health-related information. Often I see people on social media forums, specifically for tinnitus, who are in an absolute panic and a state of distress. And I understand that you're all looking for a sense of belonging and connection and the ability to relate to people with a similar experience, and that is a normal behavior. But when you are constantly on those forums, what you're doing is feeding into that anxiety cycle, particularly when you read really distressing posts that can actually flare up anxiety within you. And cause that physiological reaction, which has that domino effect in causing your tinnitus to potentially worsen. So that is a really unhelpful reassurance-seeking behavior. And so I suggest that if you are one of those people that are constantly on these health forums with lots of people in a state of panic or distress, and you're taking that in like a sponge, I really suggest that you start to wean off of that and lessen your exposure to that. Because in my experience, what I've seen is that some people will actually try and they focus on their tinnitus even more. And so they might even start manifesting different symptoms that weren't even actually there prior to whatever they read. So I'd really suggest that you wean off of that and only go onto forums which are really quite positive and supportive of your recovery. You can't unsee what you see, so be protective of what you put into your mind. If you see yourself in that list of behaviors or symptoms of health anxiety, you can definitely seek support from a health professional to guide you through that, to better support your body and mind and your tinnitus. I hope that helped. Thanks for watching.